Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Premenstrual Syndrome, PMS. Introduction. Premenstrual syndrome, or PMS, is a group of symptoms that start 1 to 2 weeks before a woman's period. For some women, the symptoms of PMS are severe enough to interfere with their lives. This type of PMS is called premenstrual dysphoric disorder, or PMDD. This program reviews premenstrual syndrome. It includes information about the causes, symptoms, and treatment of PMS. Information about premenstrual dysphoric disorder is also included. Premenstrual syndrome. Premenstrual syndrome is a group of symptoms linked to the menstrual cycle. It is more commonly known as PMS. PMS symptoms develop 1 to 2 weeks before a woman's period starts. The symptoms usually improve after you start bleeding. PMS can affect menstruating women of any age. The effect is different for each woman. For some women, PMS is just a monthly bother. For others, it may be so severe that it makes it hard to even get through the day. PMS goes away when a woman's monthly periods stop, such as when a woman gets pregnant or goes through menopause. Symptoms. PMS often includes both physical and emotional symptoms. PMS symptoms vary from woman to woman. About 3 out of every 4 menstruating women experience PMS. The physical symptoms of PMS include acne, appetite changes or food cravings, feeling tired, headache or backache, joint or muscle pain, swollen or tender breasts, trouble sleeping, upset stomach, bloating, constipation, or diarrhea. The emotional symptoms of PMS include anxiety, crying spells, depression, mood swings, tension or irritability, trouble with concentration or memory. The symptoms of PMS recur every month the woman is menstruating. However, in some months, the symptoms may become more severe. The symptoms of PMS usually become more severe in the 20s and 30s than in the teenage years. After the early 30s, they may become less severe. They disappear after menopause. For some women, the symptoms of PMS are severe enough to interfere with their lives. This type of PMS is called premenstrual dysphoric disorder, or PMDD. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. The causes of PMS are not clear, but several factors may be involved. Changes in hormones during the menstrual cycle seem to be an important cause of PMS. These changing hormone levels may affect some women more than others. Chemical changes in the brain may also be involved in PMS. Stress and emotional problems, such as depression, do not seem to cause PMS. However, these problems may make PMS worse. Some other possible causes of PMS include drinking alcohol or caffeine, which may alter your mood and energy level. Eating a lot of salty foods, which may cause your body to retain fluid. Low levels of vitamins and minerals. Risk factors. There are some risk factors that increase the likelihood of PMS and severe PMS, known as PMDD. Some of these risk factors can be controlled, but some cannot. A lack of exercise and high levels of stress may increase your risk for PMS. Staying active and regularly working out may help prevent PMS and relieve stress. Learning some stress management techniques might also be helpful. A lack of certain vitamins may also contribute to PMS. Talk to your healthcare provider about finding the right amount of each vitamin for you. Taking supplements or eating foods that include these vitamins could help reduce your risk for PMS. A poor diet may also be linked to PMS. Eating a balanced diet may reduce the likelihood that you will develop PMS. Talk to your healthcare provider or a dietitian if you need help balancing your diet. Some risk factors cannot be controlled. Women who have a family history of premenstrual syndrome are more likely to have the condition. Age is also a risk factor. The symptoms of PMS usually become more severe in the 20s and 30s than in the teenage years. Previous difficulties with depression, anxiety, or other mental health problems may increase your risk for PMS. This is especially true for developing PMDD. Diagnosis. Women with PMS should check with their doctors when the symptoms become severe in order to consult about possible treatments. A woman may also have a new mental or physical symptom before her period and may want to check if it is PMS or another condition. Your healthcare provider may diagnose PMS based on which symptoms you have, when they happen, and how much they affect your life. It is important to record your symptoms on a calendar to help with the diagnosis. Keep track of which symptoms you have and how severe they are for a few months. Record your symptoms each day on a calendar. Take the calendar with you when you see your healthcare provider about your PMS. Your healthcare provider will also want to make sure you don't have one of the following conditions that shares symptoms with PMS: anxiety, chronic fatigue syndrome, depression, irritable bowel syndrome, problems with the endocrine system, which makes hormones. Treatment and prevention. Many different treatments may help to ease the symptoms of PMS. No treatment works for every woman. You may need to try different ones to see what works for you. Treatment options for PMS include lifestyle changes, medications, vitamin supplements. If you have mild PMS symptoms, some lifestyle changes may help you feel better. The following includes some steps you can take that may help ease your symptoms. Exercise regularly. Ask your healthcare provider how much exercise you should get each week. Eat healthy foods. Throughout each week, you should eat fruits, vegetables, and whole grains. Also, avoid the following foods, especially when you are having PMS symptoms: alcohol, caffeine, salty foods, sugary foods. Other lifestyle changes that help to manage PMS include finding healthy ways to cope with stress, getting 7 to 8 hours of sleep each night, quitting smoking. Other than lifestyle changes, you can also treat your PMS with medication. Over-the-counter pain relievers may help ease physical symptoms such as cramps, headaches, backaches, and breast tenderness. These include aspirin, ibuprofen, naproxen. In more severe cases of PMS, prescription medicines may be used to ease symptoms. Antidepressants can be used to treat mood symptoms. Birth control pills can make a woman's period lighter and ease cramps and headaches. Some pills are more effective than others in managing PMS. Ask your healthcare provider which pill he or she recommends. Alternative therapies are also available to treat PMS. Certain vitamins and minerals have been found to help relieve some PMS symptoms. These include calcium, folic acid, magnesium, vitamin B6, vitamin E. Some women find their PMS symptoms relieved by taking supplements. However, few supplements have been proven to work, and they may interact with other medicines you are taking. Talk with your healthcare provider before taking supplements. You cannot prevent PMS, but there are several things you can do to manage severe symptoms. Check with your healthcare provider before making these changes to your lifestyle.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Premenstrual syndrome, or PMS, is a group of symptoms that start 1 to 2 weeks before your period. The physical symptoms of PMS include acne, appetite changes or food cravings, feeling tired, headache or backache, joint or muscle pain, swollen or tender breasts, trouble sleeping, upset stomach, bloating, constipation or diarrhea. The emotional symptoms of PMS include anxiety, crying spells, depression, mood swings, tension or irritability, trouble with concentration or memory. For some women, the symptoms of PMS are severe enough to interfere with their lives. This type of PMS is called premenstrual dysphoric disorder, or PMDD. Many things may help ease the symptoms of PMS. Over-the-counter pain relievers may be used to treat physical symptoms. In some cases, a doctor may prescribe medications. Certain vitamins and minerals have been found to help relieve some PMS symptoms. Making certain lifestyle changes can also help. If you are experiencing difficulty as a result of PMS, talk to your healthcare provider about treatment options that may work for you. Thank you for using Explain.